may have heard a lot about Botox and fillers on TV or from Hollywood, but what are they really? How do you actually get them injected? Does it hurt? To help us learn more about this tonight, Dr. Gaber brought with her a very brave patient, and we have with us for that, we have Brenda, and then we have her medical assistant, Dina, and we're going to run through some of these procedures. So take it away.
Great, thanks. So we're going to be doing a number of things this evening for Brenda. First, we're going to start and we're going to treat some lines that are at the top part of her head, on her forehead. She has what many people do, are these horizontal lines that go across the forehead, and those are created whenever we make movements. So look surprised. Right, so when we lift our eyebrows up, it makes the muscle move and it crinkles the forehead, and then we get these lines. So we're going to relax that muscle to get rid of those lines, and we're going to do that with a neuromodulator, and there are a few on the market. Botox is one of them.
That's one we all use, yes. But that's really just a brand name, right?
Yes,
kind of like
that's
Kleenex.
One of the brands.
Okay.
There's also one that we're going to use tonight. It's called Dysport, so we'll be using that one tonight. They both work very well. And so we'll do some injections on the forehead to improve these lines. Also, another area which is very commonly treated with either Botox or Dysport are what people call the 11 lines, those lines between the eyebrows that come about when we make kind of a scowl or a mean face or even a concentrating face. You get these lines here.
Do it again so I can see. Excellent.
Yeah, great. And we're also going to treat these lines, the lines around the eyes that a lot of people call the crow's feet. So we'll get started here. I'm going to have you press your head back against this, and to do injections with the neuromodulators such as Botox or Dysport, you really don't need any numbing cream ahead of time.
Okay. It just feels like a little bit of a bee sting, but it's not a really painful injection.
Exactly,
okay.
Exactly. So I'm going to ask you to lift your eyebrows up, okay, and back down. You can close your eyes. Great.
Now the effects that we're going to see from this, from the Dysport effect, isn't going to give us the same effect immediately. It's going to take a number of days, right, for her to see the effect?
Exactly. Usually this kicks in a few days, and she'll notice that she's no longer able to raise her eyebrows quite as high as she used to be able to, and it'll start to fade these lines. And usually these products last about 3 to 4 months.
Okay. Now, so if even somebody already has deep wrinkles, if they get the Botox or Dysport injected, it'll actually make those lines go away?
It will. Sometimes it takes a number of treatments,
okay.
But over time, as the muscle relaxes, those lines will go away.
All right. So we're doing this one tonight just so you can actually see how it's done. We won't see the effect of it on blocking the muscles tonight. But we can always put up a picture on the website, Brenda, of you in about 2 weeks or a week or so to actually see that effect. You do see the little bumps that she gets from the injection, and that'll go away in, what do you think, Emmy, about a couple of hours?
Oh, not even, just a few minutes.
Oh. And now also people can have these things if they want to have it for prevention as well?
Exactly. That's a great point, because I have a lot of people, a lot of patients that come into the office and they say, am I too young to do this? Is it time for me to do this? Do I have, are my wrinkles deep enough? And really, I have patients that come in that are good candidates for it even before they develop the lines. They might look at their older siblings or their mother or father and say, oh, my parent has those deep 11 lines between their eyebrows. I don't want to get those, so I'm going to do Botox or Dysport preventatively. So a lot of people will do that as well. That's becoming more and more popular. There really is no set age for any person. You have to really look at the person and talk to them. It varies greatly from person to person. So we're going to actually do just a couple here, and this would be, we treat this muscle complex in here to get rid of these lines that are often in the center. So I'm going to have you turn towards me. Great, you're going to feel me touching by your eyebrow here. All right, here we go.
Now, there are always concerns about any injection into your face. It's actually, you know, relaxing and making a muscle not to move. Are these, what's the safety profile for these?
These are very, very safe. You may have heard in the media sometimes years ago some reports about serious side effects from things like Botox or other neuromodulators, but really it's when it was used in very strong concentrations for medical problems other than for wrinkles, and the people who were receiving them were already very, very sick. So there are no reports of very serious side effects occurring when people are treated for their wrinkles. So really, a little bit of bruising might be the most common side effect.
Okay.
And even that is not terribly common.
Okay. Now, another point I want to make, whether people were to decide to ever want to do this or not, this is mainly just to have people know how it's done. But if you want to do it, always recommend that they go to a dermatologist or a plastic surgeon especially.
Exactly. Somebody who's been trained to properly do any of these injection techniques that we're going to show tonight. It is definitely best to see a physician, and a physician who's been specially trained and knows how to do these things.
Well, Emmy, Brenda, Dina, thank you so much for your help.
Sure.
You were a great model, and I can't wait to see the full effect in a couple of weeks. To find more information on all the products we mentioned tonight, to find out how to reach Dr. Gaber or the BU Cosmetic and Laser Center, you can find all that at my website at drdarria.com, where it has all the links so you can go reach out to Dr. Gaber or send me any questions that you may have.